and then over time contribute to some of these common chronic diseases that we talk about in lifestyle medicine, because they're very preventable once we build the foundation. And what I've learned along the way too is how the emotions are involved with this. So we'll talk a little bit about the steps that can be taken to bring the body and mind and spirit back in balance through the lens of hormones. So for a moment, just think about just what comes to mind when you hear the word hormones. There's something that probably pops into your mind first thing. Just think about what that is. Have you ever had your hormone levels checked? Did a doctor say, we really should check your hormone levels based on what you're going through, right? Maybe yes, maybe no. And maybe some of you are taking hormones, different types of hormones, for health, maybe for happiness or well-being, so, but hormones, when we talk about them, how many thought of the ones on top first, the reproductive hormones? Yeah, so when we just sort of put that word out there in medicine or in healthcare, that's what we think of: estrogen, progesterone, and testosterone. And maybe the levels are too low. Commonly, as we get older, they get lower, and we think about replacing them. But sometimes they're high, or they fluctuate a lot, and that affects the body. But I put that on top because I thought that might be what you think of first. How many of you thought of thyroid hormone first? Yeah. So perhaps you were diagnosed with low thyroid, again, more common than high thyroid, and you're taking T4 or T3, the types of hormones we can give in a pill, to balance those out. And that balances out energy and mood and some other things, because depression, weight gain, kind of dry hair, dry skin, can be some of the symptoms someone has when they have low thyroid. How many of you thought of the stress hormones first? Perhaps someone did, because we talked about it this morning. Did anybody think of stress hormones first thing? Nobody? Really? Truly? Okay. Well, excuse me, in functional medicine in particular, we would reverse that order. We would think of stress hormones first as a key driver of how the other hormones function in the body. We would put thyroid second and reproductive third. So it's a loose hierarchy. It's not, like it has to be seen that way. But those are the three pathways we'll focus on today, even though there are many other hormones in the body. Some people even call vitamin D a hormone now, based on the thousands of reactions vitamin D helps in the body. But I did list a few more here. Sleep, melatonin can help us sleep. Orexin, we don't talk about much, but that's what keeps us awake in the brain. It's a hormone. There's all the ones linked to diabetes and the things that we talk about a lot in lifestyle medicine that we can find early and reverse and prevent. A couple of these on here are what your fat cells put out in order to help you feel full or to use insulin more effectively. And there's some that are, again, it's not so much to know what all these are, just know that there's categories of hormones in the body, and they all on some level influence each other. So I'm hoping after today, when you hear the word hormones, you think of this, and in particular, the first three and how they influence physical health and well-being. Second question, happiness. What do you first think of when you hear the word happiness? Excellent. Oranges. Yes, uplifting, refreshing. Anybody else want to call something out? What do you think when you hear the word happiness? It's a choice. Okay, we're learning that. Yes. The word joy, right? Kind of another word. Yes. Anything else? Nature sounds great.
Cute puppies.
Oh, little puppies, right. Yeah, so we have other words. We have connections in our life, like pets and people. Some people might see happiness as an inner peace. Maybe we think of laughter and smiling. Many people, researchers talk about the importance of smiling to uplift your mood. If you feel down, smile more, or laughter yoga. People might radiate or glow when they're happy, like someone walks into the room and like, that person's a happy person because they have a certain demeanor around them. Or perhaps happiness means we live a life with some ease, some space. I put low stress on there, but I don't have anybody that comes to my office that says they have low stress. When they put numbers on it, sometimes they even put them all 7 out of 10, and they say, oh, my stress is low, and I look at their numbers, 7s and 8s out of 10. That's a lot of stress to me. But, and Letitia, who talked about the essential oils, we don't live in a culture that tells us to balance activity and rest. We are told to constantly go, 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 physically, and then, as Letitia pointed out, even if we slow our bodies down, our mind doesn't necessarily slow down with it. It goes, goes, and goes. So then these stress hormones start and get activated, and the longer they're around, they influence your thyroid and your reproductive hormones. So the title of my talk, I intentionally put the words from the U.S. Constitution in there. We are entitled to this life of liberty and pursuit of happiness, right? But is happiness something we pursue? Because based on our current culture right now, there's a lot of reasons to overwork, overeat, overschedule, even over-exercise, overfeel. So I would again, one of the key messages today is how do we cultivate a balance of activity and rest, get out of the constant stress loop, and create more opportunities for happiness to come to us. Yeah. So when we experience stress, and this can be exercise, this can be getting married, there's other things that we've experienced as stress that activate these stress hormones. Having a new baby, these are things that are going to affect our stress hormones. And 2 key hormones are released. Cortisol is more talked about than the other one, DHEA. And then the storage forms are cortisone, and then DHEA that has a little sulfate group on it. So it just gets chemically changed a little bit. These can be seen as the storage forms. So the longer we have either perceived stress or create ongoing stress in our lives in certain ways, we get all these markers can go up. So everything tends to start going up. And they're within minutes of a stress event. So some people, when I have them go get their blood drawn, and I'm testing a morning cortisol level, it's high. But then they tell me, oh, I was so stressed the day of my blood draw. It will go up that fast. So that's why lab interpretation has to be kind of put in the context of the life experience as well. But cortisol goes up first within minutes, DHEA not long after that. And DHEA is meant to balance, kind of start taking the edge off cortisol, right? Because cortisol is very activating. It's going to mobilize blood sugar. It's going to, adrenaline is a hormone, but adrenaline is going to get your heart rate up and your blood flow going to respond to the stress, right? But they shouldn't hang around too long, right? And the body's elegant, so as soon as the stress response happens, it begins to balance you. We're going to have an on-off mechanism here because we don't want cortisol around too long, you'll see why as we proceed along with the talk. So we start getting cortisol and DHEA high, and then you get these more storage forms after maybe, a couple of days or so, maybe even sooner than that. I don't know the exact timeline on that. But these are all measurable. And what I'm trained to do, I did not learn it in what I call conventional medicine, but I learned how to do this in my integrative and functional medicine training, that we can measure these and do things about it. And it's important to sometimes to measure it and sometimes not. So what's the stress pathway in the body? Right. So the stress pathway is one set of hormones that uses this HP brain out to the body pathway. The thyroid also is, you could put HPT, so T could be thyroid. You could put HPG, kind of for gonads, or T for testes, or O for ovaries. Not every hormone pathway is in this sort of loop, but the 3 key ones we're talking about today are. So H is the hypothalamus in the brain. That's where the hormone response starts. So stress happens. There's a way that the hypothalamus gets notified by that. And there's a hormone released to the pituitary gland that then releases a hormone to go out to the adrenal gland. all right? And as this whole event happens, there's a loop where as cortisol goes up, ideally within, an hour or two, you would turn off the mechanism, right? So we call that a negative feedback loop or an inhibitory feedback loop, rather than pushing forward. Cortisol is not going to create more cortisol at some level. We need that off switch, right? So with brief stress, it will naturally adapt. But we live in a world where we overdo, overmove. We're revved up. We're a revved up culture, right? So on some level, everybody is in this culture together, and we have this more of a prolonged stress response. And depending on unique things about you, your body may respond a little differently over time, right? Here is what I kind of just put as a little flow diagram here, the normal stress response, which I just kind of highlighted for you, right? So you have a stress event. The brain, the HP, the brain sends a signal to your adrenal gland to make the cortisol. And that whole cascade happens. I put insulin in here because it's just so important. Many people have a slightly higher level than insulin. We're not going to talk as much about that today. But that's how your body doesn't allow too much blood sugar to be around, right? So blood sugar goes up, your pancreas creates insulin so that you can get sugar into your muscles and just have all this energy to actually take action, right? You take action, that whole up and down surge happens, and the inhibitory feedback happens, and you return to normal levels, right? But let's say you're doing a talk at a conference, and you go to bed and you're a little bit stressed, and you wake up, oh, I got to get there on time, and I got to do this. And so I might be a little bit revved up today. And that might not end until I finish this talk. That would still be normal stress adaptation, right? Now, if I went home and I had another thing I was worrying about, and then another thing I was worrying about, maybe my cat was sick, maybe a child was sick, maybe I had to travel like to Europe tomorrow, and I was going to do a red-eye flight to Europe, and I was just buzzing around the planet, that's going to start dysregulating this curve. That's a fairly normal life pattern for people. It's not unusual. And this dysregulation means that inhibitory loop doesn't function, doesn't adapt. And so this sort of low level or moderate level stress persists, and then you do keep creating cortisol, and you start getting symptoms. You might have some changes in your body, you might have some changes in your blood tests, but the most common ones are here. All right, so people come in and I do some tests, and their blood sugar's a little higher than average, and we put a name on it, prediabetes. And they tell me, yeah, I'm gaining weight, and I keep working out, and I feel like I'm eating less, but I still keep gaining weight, and I'm not sleeping well because I'm so anxious, so I'm tired when I get up. And a key set of symptoms for mood in here are anxiety and depression at the same time. So you're anxious about something, but your mood's low. And we've now figured out that when cortisol is around too long in the body and it goes up to the brain and it starts attaching to receptors there, that constant stimulation creates depression. So a root cause of depression is literally too much cortisol connecting to receptors in your brain. Right? Not what someone would probably tell me, like, what would be the cause of your depression? Do you have anxiety and depression at the same time? Yeah, I do. And then I can start figuring out sort of where someone is in the stress loop, right? For the thyroid and the reproductive hormones, two key things happen. Ongoing stress sends signals to your thyroid to start slowing down. Your lab test might be normal or slightly abnormal, but it's part of why someone's tired when they're anxious, in addition to maybe not sleeping well. And DHEA is one of the early steps in testosterone synthesis. So things that you would link to testosterone symptoms like acne, abnormal hair growth, could be there, especially for women. We'd see that's unusual. Men, we might not notice it as much. And there's an enzyme that got famous because of breast cancer therapy, aromatase. Stress usually activates that, but in some people genetically it might slow it down. And so you start getting high testosterone symptoms and high estrogen symptoms. So PMS gets worse. If you're going through menopause, your hot flashes are worse. You get the idea, right? So the stress response is foundational to living a long, healthy life. To learn the coping skills and take what you're learning today and find a balance of activity and rest. And you might not need to do much else. Right. But let's say you went to a conventional primary care doctor. What would they do? What would that person do you think? You come with all these symptoms. What would they do? Right. Antidepressants. What else, maybe? Yeah, they might start a thyroid medication if it's enough imbalanced, right? What else? Yeah, or they might do lifestyle stuff, right? They might say, like before I did lifestyle medicine and really understood the stress response, I was told to write an exercise prescription, like just put it on a prescription pad and tell your patients to exercise, to let off some steam or something, or to lose weight, right? Anything else that someone might do? Hormone replacement therapy, right? So women going through menopause, something's off, you have hot flashes, let's start some estrogen and progesterone. But estrogen and progesterone might be high, so they're not testing the levels first. And they wouldn't test anything, right? They would just basically already know from research what to do, right? And they're not getting to the root cause, which is why in the training I've taken in Med School 2.0, we talk about root cause resolution medicine a lot, right? Getting to the root cause. And a lot of it ends up being the pillars here, finding your personalized lifestyle medicine plan for a healthy, long life. Right. Okay, so you go into your doctor, you're on a couple of medications now, or maybe you're doing some really good lifestyle things like working out more to lose weight, right? But you're in now, you're kind of perpetual wired and tired. So the anxiety's there, the busy travel is there, this second or third child happens, and you're in this perpetual revved up state. And then we have different baseline resilience. Part of it's genetics, part of it's how we're eating, sleeping, oxygenating, who our friends and family and our support networks are in our community. Stressors are different. Some we might perceive as more intense. And my colleague Sarah is going to talk about how to sort of take maybe the edge off the intensity of life and come at it with a different perspective. So when I meet with someone and I talk through this with them, it's like, are you seeing a therapist? Do you have a life coach? How does your spirituality play into this? We might do some testing. Well, I will do some testing. But it's also readiness for the change. Right? So someone tells me, I love my high interval impact workout. It's the one thing I look forward to every week, even though I know that's going to keep wired and tired going and possibly lead to burnout. That won't be the first thing I suggest, right? So this is a collaboration. I talk about collaborative medicine a lot, but this readiness for change is extremely important. And lifestyle medicine coaches that I often work with in a team partnership would sit with the person and create a lifestyle plan that you can actually implement now, right? There might be an aspirational one, big picture, but what's the next best step in your life right now to balance activity and rest? I put an example here, exercise in particular, because many people I work with who are wired and tired and are actually almost in burnout are training for the Boston Marathon, are truly in a job where they're not going to be able to stop their international travel, right? But really, when someone can create the time to do this, keep regular meals, sleep times, rest and slow down, they will recover and rebalance the curve faster, and they will not go this direction. I was here. I had late phase HPA dysregulation. My career in medicine did not go exactly where I thought it was going to go, and I had some health crises in there. And I kept pushing myself, right? So when someone has chronic fatigue, fibromyalgia, chronic pain syndromes, complete burnout, including, I probably had some depression in there, but I was in denial, right? It could be that the stress response has been going on too long, right? So initially cortisol and DHA go up, and you have some of those effects. Then they come down, and they actually come way down to the point where sometimes you have to see an endocrinologist because they have to rule out complete adrenal failure because you're not making cortisol or DHEA anymore, right? That's very uncommon and almost rare to have Addison's disease, but it's important to rule that out when I work with people with burnout, right? So this burnout is physical. It's complete physical, emotional, mental, and spiritual burnout for many people. Their minds are tired. They're slow. They can't get going in the morning. They take naps every afternoon, right? And then the symptoms in the labs change too, right? So now maybe you have full diabetes, true hypothyroidism, even more central weight gain, high blood pressure, and then when the thyroid gets turned off, you're very tired, you're constipated, a lot more weight gain. Women, when they're stressed, miss periods. We know that. Maybe you can't get pregnant, and you go to the fertility specialist, and they give you high amounts of hormones to get pregnant, right? When taking a year off from a busy life and doing lifestyle medicine could have been a solution if possible, right? Maybe more affordable too. It all depends on your situation. And then low libido, right? So men and women come in and they're like, I just don't enjoy sex anymore, and I just don't have any quality of life. I'm totally burned out. So then what does your doctor do? More of the same, right? Oh, that antidepressant didn't work. Let's switch it to a different type. Oh, let's add another one. So it's just more. And so again, we're not addressing the root cause there. This is where lifestyle medicine shines, right? And one thing we're trying to do is test for this. And this can be a saliva test at home and a blood test. I do a blood test with the saliva test. But we want to get an understanding of what cortisol is doing over the course of a day. Is it normal, or is it high, normal, but not normal, or is it low, right? And so there's 4 general patterns that we see when we test for this. This might not be a surprise because we've kind of talked through this already. But when the values are normal and someone is completely relaxed, they're sleeping well, they have a balance of activity and rest, that would be normal, right? High would be wired and tired. Wired and tired could be 1 high, 1 normal, 1 high, 1 low, or they could both be normal, right? But when I talk to the person and put it in the context of their life is speaking burnout, right? The go, go, go. And by the time you're burned out, they're both low, right? Was that a little ding for me that it's a half hour? Okay, perfect timing. Okay, so Sarah, you actually can come up if you want to start preparing. So to get rebalanced, we learn coping skills. But like a friend of mine at a very busy job said, come on, you can only meditate so much if you don't maybe decrease or remove the stressor, right? Get some daily routines that are aligned with your body clocks. I think we have a speaker that's going to be speaking on that. So I won't get into that here, but just know that the times on this slide are from Ayurvedic healing, and they're being supported by modern science, that this is the ideal kind of routine to do. And then if you work with an integrative doctor, they might have supplements and herbs that can help instead of a medication. All right? So as we turn this over to Sarah.
No, it's working.
No stress, yeah.
So just know that, this is often a team. It's not one functional doctor. It's a coach. Maybe it's a spiritual director. acupuncture, energy healing. There's a long list of things you can do. And now my colleague Sarah will teach us one.